This is a complex and multi-system disease that causes a great deal of disability and debilitation for millions of Americans. Ellen Wright Clayton states of myalgic encephalomyelitis or chronic fatigue syndrome. Common symptoms are exercises, functions, and hobbies of life that often exhaust those with this condition, a symptom referred to as post-exertional malaise. This can make it hard for individuals to do basic survival and care tasks like eating, showering, or going to work or school and cleaning. The disease can be reminiscent of depression, but is not reported to have a psychological etiology, though some clinicians are skeptical. I would think that the comorbidity is high, but that the physical cause brings on the depression for those who truly have this diagnosis and resulting from a probable underlying medical condition. Those with the condition usually have poor quality of sleep, which will have an effect on thinking, concentrating, pain, and dizziness that does not improve with rest. Other manifestations include gastrointestinal and genitourinary problems, sore throat, painful, swollen tender, axillary and or cervical lymph nodes, and sensitivity to external stimuli, as well as crashing after minor exertions. Muscle pain and aches, joint pain without swelling or redness, headaches, either new or worsening, a sore throat that happens often, digestive issues like irritable bowel syndrome, chills and night sweats, allergies and sensitivities to foods, odors, and chemicals, light or noise, muscle weakness, shortness of breath, and irregular heartbeat. The cause is unknown, says Rick Erdman of National Academies of Sciences, Engineering and Medicine Health and Medical Division, or NASEM. And it is possible that ME/CFS has more than one cause and or mediating or moderating factors along with those causes. Some of the areas that are being studied include infections, immune system changes, stress that affects body chemistry, changes in energy production or metabolism, and possible genetic links. According to an Institute of Medicine report, an estimated 836,000 to 2.5 million Americans suffer from ME/CFS. Though its prevalence is in all ages, races, and genders, people 40 to 60 years old, women, and Caucasians are most commonly affected. However, most of them have not been diagnosed, with a rate of 10%. Partly due to the skepticism, diagnosis remains a challenge for those that are suffering from it, and it is only after years that a diagnosis of ME/CFS is made, and resulting treatment can be even more challenging after that. Currently, there are no diagnostic laboratory tests available, but the criteria are through a medical history, physical examination, and targeted workup that are necessary. NASEM recommends cardiopulmonary exertion tests as a diagnostic tool, and as an orthostatic intolerance and autonomic dysfunction are indicators of the condition there, which would show up on that test. Persistent and severe symptoms must be present for at least 6 months, sufficient for a differential diagnosis of ME/CFS. And the condition is still radically underdiagnosed. A diagnostic criteria for ME/CFS includes unrefreshing sleep. Sleep tests would be advised, in my opinion, to rule out other health concerns that also may overlap, and treatment of those, if found, may better the situation. Doctors may also run blood tests and urine tests to better assess and rule out other underlying causes of their symptoms, such as electrolyte level imbalance, appropriate hormones, immune function, etc. I would suggest that it should be necessary for diagnosis of this condition over others that may have a known cause and treatment. It would also be interesting to see a study comparing the occurrence of chronic fatigue to an average work week or quality of life by country and their relation to the U.S. ME/CFS unfortunately has a very high morbidity rate, and prognosis of those diagnosed is usually poor. Even though there is no cure for ME/CFS, some symptoms can be treated or managed, and this may include learning new ways to manage activity. A prescription medication for management of each symptom is usually the method of treatment. Strategies that do not involve the use of medications and might be helpful to some patients, the CDC states, are professional counseling for coping and management, a balanced diet and supplements, and complement therapies such as meditation, massage, deep breathing, or relaxation therapy. As mentioned above, a balanced diet is sure to help overall health, even if not ensuring remission of the disease. There is a lot of conflicting information about ME/CFS and diet, and there is no scientific evidence to support the use of restrictive diets, like the ketogenic diet, for example, in ME/CFS, which can use up time, energy, and money, as well as leaving you vulnerable to nutritional deficiencies, states the Association of UK Dietitians. It is suggested, however, that people with this condition base meals on potatoes, bread and rice, pasta, or other starchy carbohydrates, as they are a good source of energy, and to aim to choose lower GI carbohydrates that release more energy slower. Staying hydrated is recommended as a part of a healthy diet plan, and an interesting fact is that some people with ME/CFS may find that they are more sensitive to caffeine and may find benefit from reducing caffeine intake or switching to decaffeinated. Anti-inflammatory or antioxidant foods could also potentially play a beneficial role in ME/CFS management. Nassim recommends changing the name to Systemic Exertion Intolerance Disease, or SEID, to reduce some of the stigma associated and more accurately explain the signs within the name. This condition is really a label for a cohesive list of symptoms, and the prognosis is poor for affected individuals. It is not a diagnosis stating the causation for the patient's sufferings. At this point, more medical history information, patient interviews, and diagnostic testing will help clinicians definitively diagnose a causal condition, develop treatment plans over management, and only then will we see progress for those 2.5 million tired Americans.